Welcome to The Bridge, the official podcast for the University of Maryland, Baltimore School of Pharmacy Patients Program. The Patients Program is the bridge between the community and the researchers. The Patients Program created this partnership to help researchers listen to the community's voice in order to build a bridge to an effective learning healthcare community. Here's your host, Rodney Elliott.
I'm having a conversation with two new partners, not colleagues quite yet, but partners. I would say friends of the program here at the Patients Program. They participated and graduated from the PPA, the Patients Professors Academy, last year, and they have actually continued work with us in some form, in some capacity, and their contribution to what we do here at the Patients Program has been fantastic. We've learned a lot from the stuff that they do in their field, and hopefully they've learned some stuff on how to engage communities, how to, communicate with different communities and have the confidence. Well, they already had confidence in work they do, but I think they instill confidence in some of their colleagues in their space on how to truly engage folks. We'll have a lively discussion today, so I'm going to get right to it and introduce two, again, community members of the Patients Program. Dr. Patrick Gee, he has his own consultant agency. He's the founder of that agency. He's an advocate for folks, particularly in the kidney disease area, but advocates for folks in general, folks that don't have a voice. And then we have Beth Brooks. Beth Brooks is fantastic. She's been a partner with ours, working with us from Santa Fe. She's the head of patient insight and behavioral sciences. And we'll get into a conversation mainly revolving around their participation in the PPA, what they learned from it, how they've implemented some of the stuff that they have learned or found out through the PPA and the work that they do. And you know what? We may have a couple gems that we just don't know is going to pop up, which is great here on the bridge. So thank you both for joining us. Patrick, Beth, how are you guys doing?
Doing great.
Great. Just great. Thanks very much.
We're going to dive right into the conversation. Like I mentioned earlier, guys, when I introduced everyone, that Beth and Patrick both graduated from the PPA last year. And if those of you guys have been following us enough, following the Patients Program, know a little bit about the PPA, it's an awesome cohort where we have researchers, community members, patients, all come together for a 6-week course and class, and we're discussing things on how to do patient-centered outcome research the right way, the genuine way, the authentic way. And I'm going to pose this question to both of you guys, but Patrick, I want you to go first. How has participating and graduating from the PPA basically enhance your skills as it pertains to research and engaging in the work that you do?
It was almost like going back to college again, but just a shorter version. It was such an honor and pleasure to graduate, to go through this program. And I have really been singing the praises of this program as if I literally walked across the stage in a cap and gown. And I've been telling everybody on every committee that they need to go through this. And I even have given them a synopsis. So, like, for instance, with the work that I do, I consider myself boots on the ground in the community. And, what this program has done, it has allowed me to be able to sit in front of people and ask them, who do you see when you see me? Do you see my disease state? Do you see my color? You see my gender? Or do you see my heart? Do you see the accomplishments, the gifts and talents that I have to be able to sit at the table and have a viable discussion? It's allowed me to recognize the credible messages and the fakery that is out there. Wow. And to be able to kind of discern between the two. So the program has really equipped me, and I feel a bit dangerous. I feel so well equipped. No, I'm serious. I feel so well equipped. It's almost like it's giving me superpowers.
Wow.
And I'm not being facetious. I'm really being genuine. It has really hyped me up. And then afterwards, continuing to participate in webinars. I even gave a presentation with Dr. Mullen. So, it has been a blessing thus far. And I'm certainly looking forward to, future endeavors with the PPA.
Thank you, Dr. G. And just let everyone know, we did not pay or send anything to Dr. G.
That's right.
No words. That's all from his heart, ladies and gentlemen. We appreciate it. Beth, I'm going to bounce a question back to you as well. You participated, you graduated. How has this enhanced your skills in the work that you do over there at Santa Fe?
Thanks for asking. So I would say that it has given me a little courage, to speak a little louder, to speak a little bit more often. Santa Fe's it's got 80,000, 90,000 people working for the company, and everything from legal to medical and everything in between. So not everyone gets the opportunity to speak directly to patients, but by involving trusted messengers, we are getting direct access to patients. We're bringing them in more often. We're starting co-authoring materials. Every one of the clinical protocols that we put out into the world gets reviewed by patients first, but it's still difficult to always have in mind the barriers that exist, the behaviors and attitudes that have built up over years and years of time, and unfortunately abuse. And we have lofty goals. We want to make sure that we're bringing people from every community into and involving them, integrating them into clinical research. But it all starts with trust. And that's what the program helps you to develop, is an understanding of what it takes to build that trust. And it gives you a pathway forward. One of the things we're struggling with is scale. How do we take a program that is very one-on-one dependent and scale it up to the number of countries and the number of studies and the number of sites that we have? But it's a great aspiration to have, is that we can do that. And what I'm seeing is that I'm sitting in the center of that now, because I have all this information that I was prepared with through PPA.
When I am out engaging with community members and they decide to participate in a certain project, sometimes I get that they may be a little intimidated as well, right? That they don't have the degrees or all the letters behind their names when they are in these meetings or in these rooms, because that's what we do. We put Miss So-and-so in the community. We put her in the same meetings, in the same Zooms as Dr. So-and-so. But what I always share with them is that the letters behind that person's name is just like the lived experiences that you have in your community. So you guys are both professionals in what you do. The lived experiences count just as much as the degrees. And when they get together in a PPA setting or they get together in another meeting, it's always interesting when I see them connect and unite and either decide on something to move forward because they both shared, or they can understand each other and they can agree to disagree, but they'll still figure out a way, or they'll still chop at it to see if they can get something done. So is there a specific moment, and Beth, I pitched this question to you, is there a specific moment, or can you share a specific moment or topic or comment that happened during the PPA that may have surprised you? And, what was the jewel in that? Like, what was the nugget of jewel in that moment?
I guess I'm fortunate to be working in an industry after, regulations started making it necessary for us to have concerns about the safety of the patients, right? To us, that's just the normal way of doing business. And I was well aware of Tuskegee. I think that there are certain egregious incidents that you just, you learn about and everybody understands and knows about. But there were some that were brought forward during PPA particularly for me, it was the research into birth control and the callousness and it's just inhumane treatment that the women who were involved in that research received at the hands of investigators. And for me, that was, I felt that kind of viscerally. I'm a patient too. I don't know too many people who aren't in some way patient.
Right.
Whether it's simple, aches and pains, headaches, all the way up to chronic diseases. But I'm a rare disease patient, and there's no way that it could happen. What happened to this woman could happen to me today. But then again, these things still do happen. There are bad actors out there, and that was pivotal for me. Is if you involve the patient voice from the very beginning, if you reach out and say, "Is this research that has meaning for you? Will we be looking at changing or improving aspects of your health that matter for your better living?" And then you follow that through all the way to the end so that every aspect gets overlooked by patients. Then we avoid Tuskegee. We avoid what happened with the birth control. We avoid what has happened with Indigenous populations that are isolated. It's that for me was pivotal. We have that power to involve the patients and prevent those kinds of things from happening again.
Thank you, Beth. Dr. G, any specific moment, topic, or comment during your time at the PPA that surprised you, or just was a true jewel, a true nugget of information that was like either an aha moment or like, oh man, I'm putting that in my arsenal? Because you say you got superpowers when you go out in the community now, so you must have got something from PPA.
Yeah, you know what? I had a jewel every week. One of the things that really got me was the land agreement. I had never seen that.
Say that again.
The land agreement.
Okay, the land agreement. Yep.
The land agreement that the University of Maryland put out, acknowledging, responsibility for certain egregious incidents, revolving around illegally acquiring indigenous land and their complicity in enslaving African Americans. And that really kind of caught me off guard. I have never, in my 60 years on this earth, seen a document like that. And it really, it caught me off guard. It really did, because I had to reread it. I had to send it to some friends. I'm like, you ever seen anything like this? They was like, no. And that in itself kind of opened the pathway for me to let down my guard.
Yeah.
But another situation, and this one I have put in my arsenal and used. It was a webinar, I believe, on a Tuesday, and there were four, I think this was a topic on diversity, equity, and inclusion. And there were four African-American medical professionals, and they were sharing their experience of racism. And I'm sitting there listening to it, and I am literally mad. So when it came to the Q&A part, I asked them if they had one wish that could be granted of how they would change a form of racism to show less disparities and more humanity, what would they do? And one person said that they would remove all the doctors and medical professionals from the table when it comes to having to talk about race, and they would bring in sociologists and medical anthropologists to come in there and really do a breakdown of race. So I was like, wow. So I was working on this project at the time, and it's an educational module for people living with kidney disease and diabetes. And in the module is a health equity piece.
Okay.
But, I said we should find a medical anthropologist to participate. Well, lo and behold, how about there was a medical anthropologist in our graduate?
I'm about to say it. Yeah.
Right. And she contacted me all out the blue. We literally had a 3-hour Zoom call. She didn't contact me. She contacted me on another kidney-related thing. But when I ran the idea by, it was like, hey, you ever been on a Zoom call that cuts off? You got to restart it back up. I was like, wow. And when she started breaking down race and how it came about and why it came about, we don't have those conversations. We have so many DEI conversations, but you never see the action.
Yeah.
She gave me something that I went right back to the organization that I was working with. I said, hey, we need to do a health and justice piece, and we need to get a medical anthropologist. And I got it.
Wow.
So when are we going to do it? So actually right now, we completed the module, but this is a part of phase 2, and we're just waiting on funding.
We love hearing stories where our participants found ways to stay connected even after we may have brought them into space. We love when folks take a jewel and they implement that into the work that they do. So to hear that you guys participated, you guys found some jewels and then took it a step further, that's one of the things that PPA was always wanted to do. They always wanted to talk about, and that's awesome and great to hear. You talk about ethical considerations and research when it comes to health equity spaces. How important is that for you, because you are the voice for the voices and the face of the faces, to understand the importance of making sure we have health equity in every space that you're in, or at least talking about it? How important is that to you?
For me, it's very important. So I'll give you an example. So there is a particular community that I work with. So I live in Chesterfield, Virginia, but this community is in Columbia, South Carolina. And there was an article that came out in March of 2022. And the name of the article was called Cutoff. And the article highlighted that this particular zip code, the 29203, had the largest number of diabetic amputations in the Deep South and the second largest in the country. So being an outsider, and I read the article, my brother lives in South Carolina. So being an outsider, and even though I work with a faith-based organization, a lot of folks didn't want to talk to me because I wasn't part of the community. After I went through the program helped me to kind of understand my identity. And a lot of times, researchers, medical professionals think if you are a Black person, or you are the one that's qualified or most qualified to talk to the Black community, they forget that I'm a pastor. I do pastoral care at my church. I was an activist, especially in the area of criminal justice, prison reform, at the age of 18 all the way up. So I had to take what I learned from PPA and kind of meld it in with my personality.
Yep.
And what I found out is now that I'm a part of all these organizations and I actually have somewhat of a platform to speak, I don't speak about myself. I share their stories and their concerns. And I bring this up, whether it's in a published article, doing a webinar, any information that I take it back to this community. I went down there after I graduated from PPA and shared the book I got. Every handout And I made fun. I said, look, if you want to understand how to speak up for yourself, when you go to medical appointments and stuff like that, in 2024, you need to enroll. I said, but in the meantime, let me fight your battles. Let me assist. Especially when you live in food apartheid, when we think about social determinants. But then after going through this program, I had to look at racial determinants. I had to look at political determinants. I had to look at environmental determinants, all of these different things, and going into the community. And now the community has, they now accept me as a credible messenger. So if I come in and I say, hey, how you doing today? Do you need any food? What can I help you with? They give me their list. I look at the organizations that I work with and I tell them, hey, look, I have a meeting on this day. I'm going to bring it up. And I will call you, email you, or either drive back there and let you know how it was. So for me, it defined for me what I was lacking. And that was my true calling, my true identity, and how to actually be a credible messenger in communities that don't trust nobody, that lack trust, that see themselves as nobodies because nobody recognizes them. They don't see their humanity. All they see is their poverty. They see their skin color. They may see their disabilities, but when these folks cry out and ask for somebody to help them, normally the politicians or the folks in the area will turn a blind eye. But it's sad that somebody from the outside can hear the pleas and the cries and come in and be like, look, I'm doing this for free. I don't know anything. I just want to help.
I think the PPA was set up, or one of the things they want the folks to do was come in with a listening ear.
Yeah,
right? Like, you had to be empathetic to other people's stories, other people's situations. And when you provide an environment where, again, yes, we have doctors, we have researchers, we have folks who publish tons of papers. We've had folks that run, give backs for their communities, for their church, people who volunteer. But when you're all there together, one thing that probably was sewn in the fabric of every participant was they had a piece of empathy in their heart somewhere, and they understood, or they had a listening ear, right? And that helps in the work that we all do, right? We all want folks to have the best medical care, have the best opportunities. We know that isn't just the case because of other situations, but again, to learn some tools that can, or some guidelines that can help you in those spaces is great. And that's kudos to you for taking that down there down south. And I know they appreciated that. Beth, it kind of leads me to my next question. We talk about this credible messenger piece, and we talk about things that were shared in the PPA. Is there something that shaped your approach when it came to problem solving? Because we can sit on in this Zoom and talk all we want. We can sit in the PPA and have sessions and talk all you want, right? But okay, after you talk, where's the action? After you talk, how are you going to fix or even address the problem? Is there something in the PPA? Did you learn something in the PPA that helped you problem solve in the work that you do?
Yeah, I think there is. So for me, education is the silver bullet, right? And sometimes education isn't about the formal stuff, what did this happen in history, or, which system of the body is responsible for taking, for temperature control, or it's sometimes it's about learning to listen.
Yes.
And sometimes it's educating yourself about where you yourself have assumptions and how those assumptions color the way that you work. My intentions may be very good, okay? But let's say that in our protocol, because we've always done it this way, we require a year's worth of medical records, or what we call a complete medical record. What does that look like for somebody who is a migrant worker? What does that look like for someone who has not had consistent or any access to insurance? What does it look like for someone who lives in a healthcare desert? Or for someone who had a bad experience with a medical professional, bias related or otherwise, and has chosen to not get medical care until they reach a point in their health where it's not possible to survive without medical care, and now they have no choice. Do they have a complete medical record? So the baseline assumption I've made is that everybody has what I have, or is like people like me. And that's not a color-based assumption. It's just based on what I know. The people that I go to work with every day, we all have insurance. The people in my family, we all have insurance. So it isn't that I'm deliberately setting out to put barriers in the way of people participating. It's just that I am going through life not without checking my assumptions, without making sure that my bias isn't coloring what I'm doing. And so to learn how to do that, to go back and reassess, I've started carrying around in my head a virtual family. Dad works 2 jobs, right, to help, and mom works 2 jobs to make ends meet. And dad works as an hourly wage worker at a dry cleaner during the day, and he is picking up hours as a dishwasher at night. Mom is cleaning houses during the day, and then she works weekends cleaning office spaces. Do they have more than 2 weeks vacation? They're really lucky if they get 2 weeks paid vacation or any paid vacation at all. So if I ask them to participate in a clinical trial, they have to take time off from one of those jobs. They're not going to get paid. They're hourly, right? So they don't do half days where they get paid for half a day. They have to take the whole day. How many of those days can they afford to take? Would they have to take them as sick days? Then what do they do when they're really sick? Would they have to take them as vacation days? Then, how are they going to take any vacation to refresh themselves? If we do ask them, are we reimbursing them in such a way that their family isn't going to suffer for that time of lost wages? Are we making it possible for them to work flexibly so that the children that they have in this family, 3 different age groups, small, medium, and maybe a high school kid, have the care that they need, that their meals are made, or, are we only allowing them to come to the hospital between 9 and 5? So there's the way that things have always been done, and that those ways narrow down participation just by virtue of what they are. And so the education here is the education to shine a light on your assumptions and rethink them and have a different person in mind than yourself and people like you when you're talking about equity in healthcare. And that's what I've been trying to do. It's a message that I've taken back to the office with me. You can probably ask everybody I work with if I've told them about my virtual family, and they'll be able to tell you where dad's working this week, right? So, it's but it's not an easy thing to do. Nobody likes to throw the flashlight under the bed and see how many dust bunnies have collected under there. And I think even less do we want to examine our own assumptions and find that we're not doing what we'd set out to do. But I think it's an absolutely necessary step.
But when you flash that light underneath it there, you find yourself sleeping better. When you flash that light under there and you get that broom, or you go down there and get it up underneath it and you address it, you sleep a little better.
Yeah, and you do. As an individual, as an organization, it's like it's not that you can't stop that aircraft carrier. It's just that it takes an awful lot to overcome the momentum of that aircraft carrier and bring it to a stop.
Ladies and gentlemen, I'm sitting here talking to Patrick G. and Beth Brooks, 2 graduates of my most recent Patients Professors Academy cohort. And we're almost coming to the end as we close. I want to pitch this question to both of you guys. How do you envision the PPA influencing your career trajectory in the field, like where you're going next. I know, Dr. G, you printed out a whole booklet, and you giving a booklet away, and Beth, you have a family in your head that people know about, and they're giving Christmas gifts next year.
Yeah.
I love it. Can you talk a little bit more about that? But like, how has it really like give you the tool or the energy and the confidence to, again, push this forward in the work that you do, Dr. G?
I received an email, and it allowed me to set up a one-on-one meeting with Dr. Mullins. And he asked me that same question. And one, I was honored, but I was also caught off guard because I just thought the program, okay, you get this, all right, you're good, just go ahead and do what you want with it. But Dr. Mullins said, hey, if there's a program, there's a project that's in your mind that you may need funding for, whatever, just give us a call. We can certainly help you, train you to, how to write a grant, how to get from point A to Z. So for me, working as a consultant, it's almost like the PPA has instilled all these thoughts and ideas, giving me the tools and resources. It's almost like every time I watch a webinar, it's almost like inserts being updated on different ideas and things. Wow, you know what? I never thought about this. Oh, let me write this down. And to be able to come back to the PPA and say, look, I really want to be a part of this. Which I was asked to sit on the steering committee for the 2024 upcoming class. I'm certainly looking forward to that. So I really think that they have given me a new vision, a new mission, and certainly the support to say, hey, if you see a need out there, you want to figure out how to address it, come back to us. We will certainly introduce you to mentors that have been in that particular area. They will help you get your legs up under you. They may help you to get grants or whatever. And then, okay, we're not going to just send you back to the community. We're going to go out there with you, just to be a support system. So, so for me, it's a continual relationship. It's almost like a snowball going down the hill. I'm seeing it get bigger and bigger because the more I roll, the more I'm picking up. Man, I'm gathering. So by the time I get down to the bottom, I'm going to be nice, good, fat, filled with all these ideas and just encouraged just to go forward in my career.
Beth, I'm going to roll the snowball down to you. Is the snowball getting bigger as it's coming to you?
I think that it is. It's a heavy lift for a working professional to commit 6 weeks to a course like PPA, especially, if they've got a family and, So my thought is a condensed version that can be offered internally to the company so that it goes beyond those of us who were fortunate enough to attend over the last few years and the people that we work directly with. And we're able to coin a phrase, infect our larger group with these ideas and make them aware of the kinds of battles we're waging here when we try to establish diversity, equity, and inclusion. And it's not just race, it's gender, it's ageism, it's gender, it's people at the intersections of all of these things, right? Is people with disabilities, how do you participate in a clinical trial if you are deaf? Do we have measures in place for you to do that? So the more, again, going back to education, the more widely we can spread this information within our ranks, the more likely we are to see people pointing out places where there are opportunities for improvement, and perhaps standing up and saying, I have diabetes and I belong to a group and they would love to talk to you. Or, my sister has muscular dystrophy, and, there's a great chapter over there in South Carolina, and they would love to talk to you and give you feedback. So we would, I think, grow trusted messengers or find trusted messengers through word of mouth within the company. And then the other thing we need to do is partner with people like Dr. G, who are trusted messengers, with the people in the PPA to identify other trusted messengers around the country who already have relationships. And so there are ways we can bring input into the process and say, are we doing the right things here? Are we doing enough of the right things? Probably never enough, but, we're the things that we're trying to change, are they having an effect? To me, that's the biggest question. A lot of times in these programs, it's like we take a handful of spaghetti and we throw it up against the wall, and each one of those is a different change we've made or something we've put in place in hopes of making a difference. But how do you tell which ones really worked? How do you tell which pieces of spaghetti really stuck, if any of them? And therefore, you should continue focusing on those and just putting your energy there, and which ones you should save for another time because they're not as effective. So that's another way I think we can leverage what we learned from PPA, is figuring out how to measure where the efforts we're making are effective.
I was at a senior home that I frequently go to just to check up on some guests, some residents that live there, some participants that participate in a couple projects, and they haven't seen me in a while. And I have something coming down the pipe, so I wanted to just kind of let them know what's coming. And I sat down with them and I said, I'm going to be here for half an hour, get it over with, that's it. Wound up sitting there for an hour and a half and got a text afterwards. And she texted me, said, I'm really glad you came down and sat and talked with us, because now I don't have to tell people what the patients program is about, because they ask me all these questions and I give them the flyer, and now they know where I get all this information from. So, when you find a way to go to a particular group and stay connected with them and just sit down and listen to them sometimes, that's all that matters at that particular moment. And I'm glad you guys have found jewels that you guys have taken and put into the work that you do. I know you guys have been contacted by other folks from the PPA and our staff as well. That's awesome to hear. Before we get out of here, though, I want to give 30 seconds. If we're talking to perspective, because we're in a space right now where we are pitching Patients Day 2024, and we're about to open the application up probably another month or so. 30-second pitch from both of you guys. What would you tell someone why they should participate in PPA 2024?
This is a program that opens your heart as well as your mind. You'll walk away with a renewed sense of purpose and with terrific ideas that you can implement right away to help make this a more equitable world for everyone.
Thank you. Dr. G?
I would tell folks, if they are uncertain about their identity, and their identity, I mean, in the workplace, at home, socially, emotionally, physically, they need to join this program. Sitting on a Zoom call with all these medical professionals and nobody used their title. Everybody is wounded, afflicted, suffering, but everybody came together like family. Nobody complained, nobody fussed. We cried sometimes, we laughed sometimes, but at the end of each class, everybody walked away filled, rejoicing, full of knowledge. That is the PPA program.
Man, that was great. Dr. G, Beth, truly appreciate the time today for joining us. I know we'll be in contact later, but this was awesome. And thank you for joining the bridge.
Thank you for listening to the Bridge Podcast. To learn more about the Patience Program, visit our website at www.patience.umaryland.edu.